Hi, this is Dr. Jay Park with Cosmetic Medical Training. Today we're going to talk about Restylane and Perlane. In 1893, the first fat autografting was performed by Dr. Neuber, who successfully autografted fat into the infraorbital margin in a man with tuberculous osteitis. In the 1980s, Dr. Fournier injected fat from liposuction surgery. Average fat survival rate was around 25%. Bovine collagen was developed in the 1970s, and Zyderm implant was FDA approved in 1983. However, skin testing was necessary because 2 to 5% of the patients had hypersensitivity reaction. Hyaluronic acid was introduced to the US in 2003 with Restylane. Restylane has an hyaluronic acid concentration of 20 milligrams per ml with a bead size of 250 micromoles and 100,000 units per ml and an estimated 0.5 to 1% cross-linking. Perlane contains 20 milligrams per ml of hyaluronic acid with a larger bead size of 1,000 micromoles and 10,000 units per ml and less than 1% cross-linking. Other fillers followed that contained polylactic acid, calcium hydroxyapatite, and more. In addition to volume replacement, these fillers stimulated host response and endogenous collagen production. Hyaluronic acid is the main polysaccharide in the extracellular matrix. Skin loses elasticity and fullness due to loss of hyaluronic acid. It acts as a scaffold for collagen and elastin to bind. It also hydrates the skin because it binds water. Researchers were able to grow chains of polysaccharide and cross-link them. Cross-linking varied its degree of hardness, lift, duration of survival, and resistance to heat and degrading enzymes. Hyaluronic acid is now grown by a gram-positive bacteria and called NASHA, non-animal source hyaluronic acid gel. Hyaluronic acid has the following favorable qualities. It's effective, long-lasting, degradable. Allergy testing is not required. Similar to normal tissue texture. No special storage requirement. No need for mixing or preparation. Typically, it does not migrate or calcify. Cost-effective and safe. In the injectable form, it is a polysaccharide compound. It stabilizes in the tissue by cross-linking, which increases tissue residency. Unmodified hyaluronic acid has a half-life of 24 to 48 hours. Other medical uses of uncross-linked hyaluronic acid include injection into joints or formulation on topical products. Hyaluronic acid binds water after injection and increases the tissue volume. Cross-linked hyaluronic acid also induces fibroblasts to produce endogenous collagen. Restylane. Restylane L is a gel of hyaluronic acid generated by Streptococcus species of bacteria, chemically cross-linked with BDDE, stabilized and suspended in phosphate-buffered saline at pH of 7 and a concentration of 20 milligrams per ml with 0.3% lidocaine. Restylane is a similar gel compound without the 0.3% lidocaine. Restylane L is indicated for mid to deep dermal implantation for correction of moderate to severe facial wrinkles and folds, such as nasal labia folds. Restylane is indicated also for submucosal implantation for lip augmentation in patients over the age of 21. The concentration of Restylane is 20 milligrams per ml. Restylane is implanted into the mid to deep dermis. Restylane L combines Restylane with lidocaine, which can reduce discomfort during and after treatment. In clinical studies, 75% of patients reported significantly less pain during treatment with Restylane L versus Restylane. Patients continued to experience less discomfort for up to 1 hour after treatment. Perlane L is a sterile gel of hyaluronic acid with 0.3% lidocaine. the median particle size between 750 to 1,000 microns. Perlane is a similar gel compound without the 0.3% lidocaine. Perlane is indicated for implantation into the deep dermis to superficial subcutis for the correction of moderate to severe facial folds and wrinkles, such as the nasolabial folds. The concentration of Perlane is 20 milligrams per ml. The difference between Restylane and Perlane is that Perlane has a larger gel particle size than Restylane. Perlane is implanted into the deep dermis. Therefore, Perlane is a better choice for more severe facial wrinkles that benefit from a deeper injection into the skin. By combining lidocaine with Perlane, Perlane L helps reduce discomfort during and after treatment. In clinical studies, 95% of patients reported significantly less pain during treatment with Perlane L versus Perlane. Patients continued to experience less discomfort for up to 1 hour after treatment. In clinical trials, Restylane persists in the skin for about 6 months. Perlane persists in the skin for at least 6 months in majority of patients. Clinical studies show no significant safety profile difference between Restylane and Perlane. Both products are biocompatible with the body's natural hyaluronic acid, and no allergy testing is required. The result of a blinded evaluator assessment of the nasolabial wrinkle severity for Restylane and Perlane are represented in Table 15. The primary effectiveness assessment at 12 weeks was that 77% of the Restylane and 87% of the control patients, which was Perlane, had maintained at least 1 point improvement over baseline. When looking at clinical studies for lip injections, at 12 weeks, 7 out of 19 or 37% of the subjects were rated as improved by blind evaluators. Also at 12 weeks, all 100% of the subjects rated themselves improved when looking at their lips. Adverse experiences. In 3 studies, investigators reported the following local and systemic events that were judged unrelated to the treatment and occurred at all overall incidence less than 2%. Acne, arthralgia, tooth disorder, pain, infection, abscess, and fracture, dermatitis, rosacea, unspecified, contact, impetigo, herpetic, unrelated injection site reactions, desquamation, rash, anesthesia, facial palsy with co-administration of botulinum toxin, headache, migraine, nausea with or without vomiting, syncope, gastroenteritis, upper respiratory or influenza-like illness, bronchitis, sinusitis, pharyngitis, otitis, viral infections, cystitis, diverticulitis, injuries, lacerations, back pain, rheumatoid arthritis, and various medical conditions such as chest pain, depression, pneumonia, renal stones, urinary incontinence, and uterine fibroids. Serious adverse events have also been rarely reported. The only serious adverse event occurring during frequency of 5 times or greater were abnormal sensitivity, injury to blood supply, local tissue damage or necrosis, infection, and abscess. Hypersensitivity reactions have occurred immediately following the implant and up to 3 weeks, and some required hospitalization. Reported symptoms include swelling, severe swelling of the lips and face, redness, itching on the chest, back, puffy, burning, watery, and itchy eyes, shortness of breath, headache, nausea, vomiting. Treatments used included steroids, diphenhydramine, and unspecified intravenous medications, oxygen, and various creams. Most hypersensitivity events have resolved within 1 to 14 days with or without treatments. Bruising and skin turning white as a result of injury to blood supply blanching have also occurred immediately following the injection, with some cases resulting in necrosis. As a result of necrosis, some patients experience scarring, dark spots on the skin. Moderate to severe infection and abscess formation have occurred, with an onset ranging from 3 days to 1 week post-injection, with approximately 1 month to resolution. Symptoms include redness, swelling, pain, hard nodules. Some patients required hospitalization for incision and draining and an IV antibiotic therapy. Culture results for the reports of infections and abscess varied. Treatment included various antibiotics and steroid in some cases. Adverse events that have occurred at the injection site include discoloration, bruising, swelling, lumps, bumps, redness, pain, scarring, numbness, tingling, necrosis, and low blood supply due to blockage of blood vessels, such as ischemia. An additional event include Bacterial infections, fainting, vasovagal reactions, herpetic eruptions, dilated small blood vessels, broken capillaries, and inflammatory reactions such as swelling, redness, tenderness, hardness, and acneiform papules. Warning: defer the use of Restylane at specific sites in which active inflammatory process, such as skin eruptions such as cysts, pimples, rashes, and hives, or infection is present until the process has been controlled. Injection site reactions such as swelling, redness, tenderness, and pain to Restylane have been observed as consisting mainly of short-term, minor, or moderate inflammatory symptoms starting early after treatment and with less than 7 days duration in the nasolabial fold and less than 14 days duration in the lips. Rare post-marketing reports of immediate post-injection reaction include extreme swelling of the lips, the whole face, and symptoms of hypersensitivity such as anaphylactic shock. Restylane must not be implanted into blood vessels. Localized superficial necrosis and scarring may occur after the injection in or near dermal vessels, such as nose, lips, and glabellar area. It is thought to result from injury, obstruction, and compromise of blood vessels. Delay onset inflammatory papules have been reported following the use of dermal fillers. Inflammatory papules that may occur rarely should be considered and treated as soft tissue infections. Injection of greater than 1.5 milliliter per lip, upper or lower, per treatment session significantly increases the occurrence of total of moderate and severe injection site reactions. If a volume of more than 3 ml is needed to achieve optimal correction, a follow-up treatment session is recommended in the lips. In a meta-analysis of all Restylane pre-market approval studies that included 42 patients under the age of 36 and 820 over the age of 35, the incidence of swelling was higher in younger patients, 28%, compared to older patients, 18%. And the incidence of contusion was higher in older patients, 28%, compared to younger patients, 14%. The majority of these events were mild in severity. Restylane is packaged for single patient use. Do not re-sterilize. Do not use if the package is open or damaged. Based on U.S. clinical studies, patients should be limited to 6 ml per patient per treatment in wrinkles and folds such as nasolabial folds and up to 1.5 ml per lip per treatment. The safety of injecting greater amount has not been established. The safety or effectiveness of Restylane and Restylane L for the treatment of anatomical region other than nasolabial folds or lips has not been established in controlled clinical studies. Refer to the clinical studies section for more information on implantation sites that have been studied. The safety effectiveness of Perlane and Perlane L for the treatment of anatomical regions other than nasolabial folds has also not been established in controlled clinical studies. The safety and efficacy of Restylane for lip augmentation has not been studied in patients under the age of 22 years. As with all transcutaneous procedures, Restylane implantation carries a risk of infection. Standard precaution associated with injectable material should be followed. The safety of Restylane for use during pregnancy, in breastfeeding females, or in patients under the age of 18 years has not been established. Formation of keloid may occur after dermal filler injection, including Restylane. Restylane injection may cause hyperpigmentation at the injection site. The safety profile for Restylane lip augmentation in person of color, that is, the incidence of adverse event, was similar to overall study population, with the exception that swelling occurred more frequently in persons of color. Restylane should be used with precaution in patients on immunosuppressive therapy. Bruising or bleeding may occur at the Restylane injection site. Restylane should be used with caution in patients who have gone therapy with thrombolytics, anticoagulants, inhibitors of platelet aggregation in the preceding 3 weeks. After use, syringe and needle should be handled as biohazards. Disposal should be in accordance with accepted medical practice and applicable local, state, and federal requirements. The safety of Restylane in concomitant dermal therapy such as epilation, UV irradiation, and laser, mechanical, chemical peeling procedure has not been evaluated in controlled clinical trials. Patients should minimize exposure to the treated area from excessive sun, UV lamp exposure in extreme cold weather, at least until any initial swelling and redness is resolved. If laser treatment, chemical peeling, or any other procedure based on active dermal response is considered after treatment with Restylane, there is a possible risk of eliciting an inflammatory reaction at the implantation site. This also applies if Restylane L is administered before the skin has healed completely after such a procedure. Injection of Restylane into patients with history of previous herpetic eruption may be associated with reactivation of herpes. Restylane is a clear, colorless gel without particulates. In the event that the content of the syringe shows signs of separation and/or appears cloudy, do not use a syringe and notify Medicis Aesthetics Incorporation. Glass is subject to breakage under a variety of unavoidable conditions. Care should be taken with handling of the glass syringe and with disposing the broken glass to avoid laceration or other injuries. Restylane should not be mixed with other products before implantation of the device. Contraindications. Restylane is contraindicated for patients with severe allergies manifested by a history of anaphylaxis or history or presence of multiple severe allergies. Restylane contains trace amounts of gram-positive bacterial protein and is contraindicated for patients with a history of allergies to such material. Restylane is contraindicated in patients with bleeding disorders. Restylane is contraindicated in implantation in anatomical sites other than the dermis or submucosal implantation for lip augmentation. Restylane and Perlane should not be used in patients with previous hypersensitivity to local anesthetics of amide or lidocaine if you're using Restylane L or Perlane L. Pre-treatment guidelines. Prior to treatment, the patient should avoid taking aspirin, non-steroidal anti-inflammatory medications, St. John's wort, or high doses of vitamin E supplements. These agents may increase bruising and bleeding at the injection site. Restylane is supplied in a disposable glass syringe with luer lock fitting. Restylane L is co-packed with sterilized needles as indicated on the carton. Perlane is supplied in a disposable glass syringe with a luer lock fitting. Perlane is co-packed with sterilized needles as indicated on the cart. A patient record label is a part of the syringe label. Remove it by pulling the flap marked with 3 small arrows. This label is to be attached to the patient's record to ensure traceability of the product. The contents of the syringe are sterile. The volume in each syringe and needle gauge is stated on the syringe label and on the carton. Direction for assembly. Use the thumb and forefinger to firmly grasp around both the glass syringe barrel and the luer lock adapter. Grasp the needle shield with the other hand. To facilitate proper assembly, both push and rotate firmly. Treatment procedure. It is necessary to counsel the patient and discuss the appropriate indication, risk, benefits, and expected responses to the treatment. Advise the patient of the necessary precautions before commencing the procedure. A consent form should be utilized. Assess the patient's need for appropriate anesthetic treatment for managing comfort, topical, local, or nerve block. The patient's face should be washed with soap and water and dry with a clean towel. Cleanse the area to be treated with alcohol or other suitable antiseptic solution. Sterile gloves are recommended while injecting. Before injecting, press rod carefully until a small droplet is visible at the tip of the needle. Restylane is administered using a thin gauge needle. The needle is inserted at approximately an angle of 30 degrees parallel to the length of the wrinkle, fold, or lip. For nasolabial folds, Restylane should be injected into the mid to deep dermis. For lip augmentation, Restylane should be injected into the submucosal layer. Care should be taken to avoid intramuscular injection. If Restylane is injected too superficially, this may result in a visible lump and/or bluish discoloration. Perlane is administered using a thin gauge needle. The needle is inserted at approximately an angle of 30 degrees parallel to the length of the wrinkle of the fold. Perlane should be injected into the deep dermis to a superficial layer of the subcutis. Inject Restylane, applying even pressure on the plunger rod. It is important that the injection is stopped just before the needle is pulled out of the skin to prevent the material from leaking out or ending up too superficially on the skin. Only correct to 100% of the desired volume effect. Do not overcorrect. With cutaneous deformities, the best results are obtained if the defect can be manually stretched to the point where it is eliminated. The degree and duration of the correction depends on the character of each defect treated, the tissue stress at the implantation site, the depth of the implant in the tissue, and the injection technique. The typical usage for each treatment session is specific to the site as well as wrinkle severity. In prospective study of mid-face wrinkle correction, the median total dose was 3 mL. Based on U.S. clinical studies, the maximum recommended dose per treatment is 6 mL for the nasolabial fold and 1.5 mL per lip per treatment. Dissection of the subepidermal plane with lateral movement of the needle, rapid flow greater than 0.3 mL per minute, rapid injection, or high volumes may result in increase in short-term episodes of bruising, swelling, redness, pain, or tenderness at the injection site. When the injection is completed, the treated site should be gently massaged so that it conforms to the contour of the surrounding tissues. If an overcorrection has occurred, massage the area firmly between your fingers or against an underlying area to obtain optimal results. If so-called blanching is observed, for example, overlying skin turns whitish color, the injection should be stopped immediately and the area massaged until it returns to a normal color. If the wrinkles or lips need further treatment, the same procedures should be repeated until a satisfactory result is obtained. Additional treatment with Restylane may be necessary to achieve desired correction. If the treatment area is swollen directly after the injection, an ice pack can be applied to the site for a short period. Ice should be used with caution if the area is still numb from anesthetic to avoid thermal injury. Patients may have had mild to moderate injection site reactions, which typically resolve within 7 days in the nasolabial fold and less than 14 days in the lip. Serial puncture. This is created with multiple closely spaced injection along a wrinkle. It is used for superficial dermal injections and demands precise placement of the filler, or gaps will be found in between the injection site. It is undesirable due to the multiple puncture wound it generates. The needle is inserted bevel up. The product is dispensed like drops along the fold. You should massage to prevent nodule formation. Linear threading. This is created by completely inserting the needle into the wrinkle up to the hub of the needle and injecting the product along the track as a thread as you slide out the needle. It demands continual pressure and even distribution of the product as you remove the needle. You must stop your injection several millimeters prior to completely removing the needle from the skin to avoid superficial placement or leaking products above the skin. The skill of pushing the plunger of a syringe as you are pulling back on the syringe from the skin is a skill that may be difficult for some, but can be mastered with practice. Linear threading may be suboptimal for some deep folds as it does not give additional structural support on the sides. Fanning. This is created by puncturing the epidermis once, as in the linear threading technique, and before the needle is completely removed from the skin, you fan clockwise or counterclockwise the needle in a fan pattern to create a triangular shape. The additional spacing of the fanning injection depends on the size of the triangular shape you are trying to fill. You must avoid over-injecting the proximal end of each fanning as products may overlap and create lumps. This is excellent in deep folds as it props up adjacent skin that may be hanging over the fold.